me give you another example that's slightly different, okay? But it's the same kind of structure to help you go through, how do I check in on whether or not the plan is working for my child? So this is Alex. He's a 10-year-old, has a diagnosis on the autism spectrum, and becomes agitated when his parents take away his favorite toy as a way to set limits. Now, there's nothing we're going to do to change autism spectrum. It's not going to go away, right? Remember when I talked about addressing the what versus the why? This is the what. We know what autism spectrum is. What we're doing here is helping Alex maintain functioning and improve his functioning, not changing the autism spectrum disorder, because we can't. So the way it's showing up is his emotional and physical regulation, right? That's the agitation. The question is this still our goal, right? The short-term goals have more to do with maintaining Alex, which is about helping the parents. So helping the parents with their understanding of what's happening, what Alex's autism spectrum looks like over time, and how to help him as he grows and changes, right? Because as kids get bigger and more mobile, and their emotions start to change, kids on the spectrum, they need different ways for us to work with them as parents. So the intervention here is to support Alex's parents around what's going on with Alex, who's on the spectrum at this age, and maybe build their strengths around their social resources for support that they have, right? They don't have. Because, one of the things that helps parents the most when they have kids with neurocognitive disorders, or just kids that are tough, right, is to have some relief, like to have a moment to collect yourself, have a moment to relax, have a moment. So having social resources is critical for parents, all parents, right? Another area is a short-term goal is helping caregivers with discipline. Now, the discipline part is part of the supervision item in the CANS. So the CANS item called caregiver supervision is a blend of monitoring and discipline or setting limits. So in this case, we're looking at the supervision item for setting limits or discipline, right? Again, we might need to provide some parent coaching on helping them actually implement some of the strategies that they're learning through parent education. And the strength to tap into here is they're very involved in his care and always have been. Okay, so again, this is about supporting the caregivers, supporting Alex's parents, not saying there's something wrong with them. It's just Alex is growing and changing, and the way we need to work with him has to grow and change with him as well. So let me stop there and see if there are any thoughts or reflections.
Okay, we have been madly answering some questions. I still have a question or so to answer, but there are sort of Idaho-based things that the Federation, and please, folks, please continue to call or email us with questions about specific services in Idaho and how you access them and are they available, etc. I'm going to go back and make sure I don't see one that I haven't passed on to you. I will say that there was an earlier comment, and it reminded me of how we ended the last session, that while not related to exactly where you are right now, people are frustrated with the disconnect between the schools and they have these CANs and they're learning about their child, but the school is not really learning about the child. And we don't have a lot of trauma-informed schools in Idaho, not truly trauma-informed schools at all.
Yeah.
So people are asking, how do we bring the school into being a helpful partner in their children's
Yeah. That's a really good question. And it's hard to have all the child serving systems that impact your child work together and be on the same page all at the same time. So for example, Idaho foster care doesn't necessarily use the cans, right? So there's another system that's not quite engaged or speaking the same language. So oftentimes, you have to continue to keep advocating. I did the same thing. Now, my child's neurocognitive diagnoses were on the high functioning side. But I really didn't like some of the tools they were using with my son. So I gave them a CANS that my son and I completed and told the psychiatrist, right? I said, because he needed some medication, I said, here, why don't you use this? I'll tell you how it works and you can continue to put your perspective in here because it might be helpful, because it's something my son understands and can work with you on it. And so I also had to educate his student study team, which is the team is the first step in the state we were living. That's the first step towards an IEP. I had to educate them on the CANS and how to use it because, again, my son was comfortable with it and he was able to talk about things using the CANS when he couldn't just talk about it in his everyday language. It structured the way he was able to talk about things. So that you might have to bring the CANS in and advocate for it and help them understand, hey, here's what's going on, here's why. And if you can find supports from other parents or even your therapist, that might be a way to also help, because I did that a lot as a therapist myself.
And I will add that tomorrow is an important session for those of you struggling with these issues, because we do a bit of a dive into advocacy tomorrow. And we'll have parents with us to sort of share some of their successes in advocacy and recognize that this is a challenging world. We do have another question. Are there further trainings for mental health providers after the initial about how to complete the CANS assessment? Training to use the CANS for treatment planning and ongoing strengths-based treatment?
Yes. So the children's mental health trainers from Idaho are offering something they call CANS in Practice. That's a treatment planning training where they will go over how to develop plans and using strengths in those plans with the CANS. So that's one. There is another training that's probably a few months out that's for supervisors, so that supervisors can get additional training in how to support their clinicians in using the CANS. So that's not yet out there in for Idaho, but will be soon. So there are those trainings. Also, if you're a CANS user, you had to get certified on tcomtraining.com. There is a free course that you could take called Action Planning, which goes through, it's an asynchronous independent study. You don't have to take a test, training that walks you through action planning with the CANS. So there's different ways to get some support that are available to you as a provider right now. And by the way, parents, if you want to get more training on the CANS, we are happy, the Parade Foundation is happy to give you free access to our training site so you can see how our clinicians get trained and certified. You could do it if you want. Just let me know. I'm happy to help in that regard.